All right, you've worn a number of hats that give you various perspectives to speak to this. As after your service in the Army, you founded an emergency department staffing company that provided staffing to 52 hospitals across 11 states. What will these new rules mean for small businesses and for healthcare facilities?
Well, they're going to be devastating because there is a percentage of our population that has chosen not to get the vaccine. They have that right as far as I'm concerned. And so you take 10% of your workforce, let's say it's 10%, in many industries it is, some it's higher. I mean, you just can't take that business hit. So if you do the penalty, that's $14,000 per employee, and that's devastating to a business. So it's just it's really a crazy idea. And you mentioned tens of millions. It's actually going to affect 104 million people in America.
Let's talk about those fines for just a moment, because in the previous reconciliation bill, there was a provision that increased OSHA's fines tenfold, which would bankrupt a company overnight. Is that right in this latest version of the reconciliation bill?
So the reconciliation bill, we don't have the latest text, and honestly, she's whipping on the floor right now. They added 7 votes this afternoon to try to get, to sway those last 6 or 8 so that she can then bring the big package together to the floor today. I don't know whether she's successful or not, but I mean, that's what they're doing at this moment, and the new language is sort of still sequestered, if you will. My gut says it's still going to be in there.
I know you're standing in the House cloakroom right off the House floor, and you may have to go and vote. So if they call for the votes, just let me know, and we certainly understand that our listeners do as well. The likelihood is, as I was talking with Kevin Brady last night, we didn't have a final number on what this was going to cost. Is it very likely that they'll be voting on a bill before they've even had a chance to look at it?
Absolutely. They seem to like to do that and just surprise themselves. But the most recent version of the bill was scored by the University of Pennsylvania Wharton School of Business, and they said it's going to cost at least twice what the Democrats are saying it's going to cost.
Earlier today, the CDC director, Dr. Walensky, testified before the Senate Health Committee on Biden's, the administration's COVID-19 response. She was asked about the release of OSHA's workplace vaccination policy, and this is what she had to say.
We know the most disruptive thing in a workforce is to have a COVID outbreak and to have workers in that workforce come down with COVID infection, severe disease, and in some cases, death. Vaccination, as we have seen, decreases your risk of infection by 6-fold, decreases your risk of hospitalization and death by 10-fold, even during this Delta surge. So there is absolutely a public health priority to get people vaccinated and to continue the important prevention and mitigation strategies, including masking, to keep them safe.
So, Congressman Green, why are we not having a conversation of all the facts? Why are they not talking about natural immunity and factoring that into the discussion here?
Listen, the CDC has, failed America, to be completely honest with you. They're relying on observational studies that have no control group when it aligns with their, and a sample size of 60 or 70 when it aligns with their political view, and then they're disregarding randomized controlled trials, which are much better, much more scientific with a sample size of over thousands, and they ignore those when it violates their narrative. One of the biggest problems with COVID is the loss of trust in America's scientific methods, and that is a tragedy. We've discovered what I call the authoritarian bias in medical research now. Those that want to enforce their authoritarianism on others, it biases studies. And of course, there's the anti-Trump bias. If Trump says it, then obviously they're going to find a study not to support it. So this new poison in our scientific systems has really hurt America.
Yeah, I actually wasn't going to go there, but as a doctor, I want to ask you that question. You being the doctor, me not. As you being a doctor, Are you concerned about the long-term implications of this distrust because we've politicized a health issue?
Sure, you take the mask decision by the Democrat Party here in the House. Honestly, it motivates people not to take the vaccine in this case, because people go, well, if I take the vaccine, I still have to wear a mask, and that's what they're communicating. And I think they're doing more harm that way than, us not wearing masks. And I'm a physician. I make decisions based on risk and benefits.
Right.
And, I think that the long-term effects of that are profound.
Let's talk for just a moment about last week. We've seen now this vaccination the shot has been approved for children. We fully anticipate that this is going to lead to mandates for children. Now, unlike other vaccines where we've had longitudinal studies where we've been able to see the implications, the impact, the effectiveness of these, we've not had this. Are you concerned about the mandates coming there?
My frustration is it goes back to that, how we make decisions as a doctor. You make decisions based on risk. Right. And benefit. And if let's say you're 60 years old, I'm 57 on Monday, right? So I have a higher risk of COVID than I do the vaccine. So it's wise for me to take the vaccine. There aren't enough studies in children, I think, to show the risk-benefit ratio, and we know the mortality for children is almost zero. In fact, it, statistically is zero. Just about if they have no comorbidity. So what we're doing is we're adding some risk where the risk of COVID is just almost zero.
You're listening to Washington Watch. Joining me by phone off the House floor, Congressman Mark Green of Tennessee, ER doctor. So what is Congress's response? Look, I know the Republicans are in the minority, but will there be any effort to roll back this mandate?
So obviously we're going to push. We'll file bills, but it's very unlikely that the left is going to do anything. They can't learn from a trouncing that happened, and I know you're going to talk about this later in your show, but they just seem to double down on everything that caused them to lose all across this country on Tuesday. So I don't expect a change from them. We'll continue to fight it, but it's unlikely that as long as they're in control, anything's going to happen differently.
Well, Congressman, again, thank you for being generous with your time. I know you're on the right off the House floor. You've got a vote.
I'm on the clock, yeah.
Thanks so much for joining us.
Take care, Tony. Thank you.